versus facts. There's a lot of information out there on the coronavirus, especially on social media. We're not just fighting the virus, but also the misinformation. I'm Dr.Spoorthi, and I have Dr. Arun here with me to discuss some questions you might have about COVID-19. So, is the coronavirus infection a death sentence? Actually, it's not. Statistically, you're likely to recover just fine. 75 to 80% have virtually no symptoms or mild symptoms and recover without complications. Typically, younger people, women, and those with no significant medical problems tend to do better.
If younger people only get mild disease, there's no reason to worry, right, if you're young? Well, here's the thing. Although it is likely that younger people get less sicker with COVID, there have been many reports of perfectly healthy people getting really sick and even dying from the infection. So age alone is not a surety against the infection. More importantly, younger people might transmit the disease to others even if they don't get very sick from it. The so-called asymptomatic carrier. We are increasingly realizing that this plays a huge role in the transmission of this disease.
So, do masks protect you from COVID infection? Well, this one is controversial. While masks confer some degree of protection to the wearer, it plays a much bigger role in preventing droplet infection to others, meaning it is more for protecting others than self. However, it has been noted that in countries where mask wearing is more common, the infection has been better controlled.
So here's an easy one. So there's a lot of information out there that says salt gargles and nasal rinses. Can these get rid of the infection? The short answer is no. They might make you feel better, but they don't really prevent the infection, nor does garlic for that matter.
Sanitizers are better than soap because it has alcohol? Are we right with this? Soap and water is still the best way to clean your hands. Sanitizers that have an alcohol content of about 60 to 90% are most effective. So it is important to have the right ratio. Soap and water is definitely cheaper and less inflammable, readily available. So I would go with that one.
India has shown lesser numbers compared to the rest of the world. And we don't know the reason exactly. So lots of theories. This is the heat, our spices, natural immunity, BCG vaccination. So here's the thing. There was one study that has showed that in countries with BCG vaccination, the vaccine against tuberculosis, there's less infection than in those countries without. And there are some ongoing trials to study this further. We don't know yet. The COVID-19 infection is an infection by a new coronavirus. It is unlikely that we have any kind of natural immunity against this, unlike the seasonal flu. The heat theory, while interesting, there's no conclusive proof yet. I'm hoping that one of the above is true, but there is no definitive data yet, unfortunately.
Our numbers are probably low because the infection started later in India than other countries, so our peak will be seen later. Further, we have implemented lockdown fairly early on in the course, hence the rate of transmission might be lower. Another important contributor might be our low testing numbers compared to other countries like South Korea and Iceland. So, can we get back to normal routines as soon as the lockdown is removed?
The answer is a definite no. We cannot and should not. Until we get a firm handle on controlling the infection, it would be an extremely risky move to get back to our routines or business as usual. Social distancing and hand washing are here for the foreseeable future. Quarantine and lockdowns might be needed depending on how the disease spreads in the next several months.
So I would still avoid unnecessary travel and social gatherings. Well, hope this was helpful. Stay tuned for more such videos. Stay safe, stay healthy. Thank you very much.
Thank you.